Hello, we are the Leidos Health Team, and we are here to talk about opioid misuse within the United States. First, to introduce our team, hello, my name is Chan Kim. And to introduce our leadership, we had Dr. Julie Rosen, who was our liaison between Leidos Health and us at Tech. We have Jay Winkler, who is our in-program advisor. We have Dr. Ann Brown, who's our faculty advisor, and Dr. Linda Christie, who is the new director of CBA. To talk about the mission need, this is a graphic of data from the CDC from December 2020 to December 2021. 46 states have an increase in opioid overdose death rates, and Hawaii, Maryland, and New Hampshire had a decrease in overdose death rates, with Wyoming not having sufficient data. And in 2019, VA Secretary Robert Wilkie stated that veterans are twice as more likely to die from opioid misuse than the general population. To talk about a problem statement and how to address it, we came up with what evidence-based policies or methods could we utilize to combat veteran opioid misuse. And a successful policy would include opioid overdose, our central goal, homelessness, and finally suicide amongst the veterans. Now I pass it off to Moomin for the interview scope.
Thanks, Chan. So throughout the course of our research project, we gained a vast amount of qualitative as well as quantitative data in order to help guide our research. The primary form of qualitative data that we obtained was through interviewing medical health professionals across the state of Virginia in order to gain a deeper understanding about the opioid crisis. The scope of our interviews consisted of us interviewing medical health professionals in fields such as psychiatry, neurosurgery, pharmacy, as well as anesthesiology. Question topics consisted of mental health, suicide, policies, treatments, as well as COVID-19. Questions were asked based on profession, starting off with general questions and moving on to more field-related questions. So based on our interviews, these were four of the main findings that we concluded. The first one was inadequate mental health resources, where based on how you were discharged, you might not be eligible for certain programs such as the VA. And even if you are eligible for these programs, you might not have access to them, especially in rural areas. The second one is the stigma surrounding opioid misuse. There is a common misconception around those who are dealing with opioid addiction, where members in the community tend to not have compassion and empathy for those suffering from this condition. So therefore, lawmakers and governments are hesitant to implement policies that could actually help out these people. The third one was prescriptions based on subjective pain. Subjective pain is not something that you can physically see or look at or identify. And also everyone has different pain thresholds. So it's not a very consistent method in order to use to prescribe prescriptions. The last one was the lack of pain management alternatives. We live in a society today where if you're feeling some type of pain or discomfort, you usually go to the doctor and you get prescribed a pill. Now, that might be an adequate short-term solution, but this is not an adequate long-term solution to problems that are not going to go away with just the use of medicine. I'll now be passing it off to Samaya to talk about our proposed policies.
Thanks, Moomin. Getting into our first proposed policy, we recommend creating holistic treatment centers for veterans. These would have harm reduction facilities such as medical professionals and clean needles on site in order to prevent overdose deaths and bloodborne illnesses. There would also be a veteran community area so veterans could speak to those going through similar issues as them, as well as mental health resources, since there is a high correlation between mental health issues and opioid misuse. There would also be alternative pain management such as yoga and acupuncture for veterans suffering with chronic pain. Now, while this would be a good solution for an urban area, a rural area would need a different solution. Veterans have treatment centers, have more difficulties reaching treatment centers in rural areas. Currently, there are Leidos vans that rural areas and provide medical care that veterans may not otherwise be able to access. So we would take that method and apply it to naloxone vans, which would go to rural areas and do naloxone demonstrations and distribution, as well as provide education on the risks of opioid misuse. There would be a teach the teachers mentality. So we would be reaching out to community leaders in the area so that they could further distribute that information and prepare the community better for opioid misuse and possible overdose. Another issue that we found within the current system is the lack of risk assessment. The current risk assessment within the VA is not adequate, And we recommend creating a compassionate risk assessment questionnaire so that veterans can be asked questions such as, do you have chronic pain? Do you have a job lined up after this? Things like that, so we could accurately assess whether they are at risk for opioids misuse. So with that, we would be providing that risk assessment and providing them resources. Along with that, we would be providing education on the risks of opioid misuse, as well as resources such as overdose prevention kits, which would contain CPR aids as well as naloxone, in case they or somebody they know overdoses. Now, moving on to the cost-benefit analysis, the current cost of the opioid epidemic, according to the CDC, is $1.021 trillion, and the estimate includes costs for healthcare, criminal justice, and loss of productivity. While it is important to reduce these monetary costs, it is also important to look at the loss of life. There were 100,000 overdose deaths from April 2020 to April 2021. This is a 28% increase over the previous year. And while I said before, reducing monetary costs is important, there is a moral value of reducing the loss of life as well, especially within the veteran community. They have served a country and deserve to live a long and happy life after transitioning to veteran status. It off to Brian to talk about the data visualizations and the conclusion.
Thanks, Maida. As we mentioned, our interviews with medical professionals revealed that current policies are not equally effective in urban versus rural areas. The goal of our Tableau analysis was to identify the high-risk areas across the country that would be good locations in which to implement our recommended policies as pilot studies. We use geographical maps similar to these to identify high-risk areas with large amounts of opioid overdoses, dense veteran populations, and high veteran affairs medical spending. The veteran population graphs here show that while California has a low percentage of veterans, the size and popularity of the state still lead to California having the largest total veteran population out of any state. On the other end of the spectrum, West Virginia has a low total population, but a very high concentration of both veterans and opioid overdoses. Our analysis identified California, West Virginia, Texas, Florida, and New York as high-risk states, as our top 5 high-risk states, with West Virginia and California being the 2 primary states that we recommend implementing our policies in as pilot studies. In conclusion, our team identified 3 primary things that need to be addressed in fighting the opioid epidemic in the veteran population. 1 is the reduction of stigma against those struggling with opioid misuse who are seeking safer methods. 2 is increased distribution of naloxone, both at the time of transitioning to veteran status and via rural distribution vans. And 3 is expanded community resources via our holistic treatment centers. As a group, we really appreciated our time working with Leidos and our sponsor, Dr. Julie Rosen. She really showed us the ropes of how to do a team project in a consulting-esque situation. So we really are appreciative of that, and I'm sure we will all be using it in our future jobs. Thank you very much for your time, and if there's any questions, we will answer those now.